Iliotibial band syndrome. Definition of iliotibial band syndrome.
Iliotibial band syndrome can cause pain from the knee to the outer hip and may limit your ability to move. The iliotibial band, or IT band, is a thick strip of connected tissue on the outside of your thigh. It helps move your thigh by connecting your hip muscles to your shin bone, or tibia, right below your knee. Iliotibial band syndrome is an overuse injury that occurs when the band becomes irritated, usually on the outside of the knee. It is commonly developed in endurance athletes, such as long-distance runners and cyclists.
Anatomy of iliotibial band.
Now, the iliotibial tract isn't classed as a muscle. Rather, it's a thick band of connective tissue known as fascia. However, the iliotibial tract is actually connected onto the tensor fascia lata muscle, which you can see right here, and it's also connected onto the gluteus maximus muscle as well. And you can see how the fibers of the gluteus maximus and the tensor fascia lata muscle are merging into the fascia of the iliotibial band through an aponeurosis. And that means when these two muscles contract, they can influence the iliotibial tract.
In terms of its function, it's involved in hip stabilization, so it supports the pelvis during single leg stance, knee stabilization, so it resists varus forces, aiding with lateral stability, and force transmission, so it transfers forces from the TFL and gluteus maximus to the lower limb.
Mechanism of injury.
The mechanism of injury. Iliotibial band syndrome occurs from overuse, not acute trauma. The exact mechanism, however, of the pain is unclear. Previously, pain was thought to be due to friction from the iliotibial band moving back and forth over the lateral femoral epicondyle during activities such as running or cycling.
Iliotibial band is repeatedly shifted forward and backwards across the lateral femoral condyle. Impingement usually occurs around 30 degrees of knee flexion. There may be swelling and tenderness and crepitus over the lateral femoral condyle.
Clinical features of iliotibial band syndrome. Risk factor of iliotibial band syndrome.
See someone who has one leg that looks longer than the other? Here's why. If you hike one hip up, it makes the legs appear uneven. People will do this if their low back is tight on that side, and they typically present with limited hip external rotation.
Management of iliotibial band syndrome.
Treatment of iliotibial band syndrome in the acute setting is rest and avoid activities that worsens the pain, using ice, analgesia such as ibuprofen, and then eventually gradually rehabilitation with stretches and strengthening exercises. People should also slowly return to their sports or regular activities less than 50% of normal capacity. In the chronic phase, when these acute treatments do not work, glucocorticoid injections may be used. Surgical release of the iliotibial band is also an option for complicated cases.
Physiotherapy management.
Go and get yours. If you're a true hustler, you're gonna be loyal. Wanna be the root from the hustle and the heat. Turn you inside out and make the game obsolete. Hustle hard to the You don't know what you like, you should check it in. On top, guy, that shit good. If you catch me on my hustle, I may hit you with the clue, whatever. Makes me happy, has to be my luck. I hustle hard, surviving, trying to make a buck. My hustle game